to handle this issue of health care. So we need to get this done, folks. I know the Congress is getting ready to take a break. We'll call it halftime. Then you come back on the field and you got to get ready and get this thing won. Now, news today, Blue Dog Democrats and House leadership got a little bit closer to an agreement. Joining me now for all of that on this breaking story is House Majority Leader Steny Hoyer. Steny, great to have you with us tonight.
Ed, always good to be with you.
What do you make of these numbers? Are you losing the PR war on health care reform in this country? Where are you at right now?
I think clearly the American public have been watching part of the debate, both in the Senate and the House, as we go through the committees, and they see a lot of different opinions, as you would expect in a Democratic debate. But I think they understand, and that poll reflects it, that A, they want a health care reform bill. 94% of them, you say, are concerned that we won't get the job done. I want to assure them we're going to get the job done. And as you said a little earlier, we made significant progress last night. The Energy and Commerce Committee is back at the table marking up their bill. They're the third committee, the final committee to mark up the bill in the House. We expect them to pass that out sometime later this week. And then we expect to take the month of August, do a lot of hard work at looking at this, having the American public look at this, give us their input. We expect to come back here after halftime, as you point out, and we're going to score a touchdown for the American people and giving them health care they can count on.
I tell you what, Congressman, this is going to be a brutal halftime. I mean, the grassroots of this country are going to have to get together and get after it and let the Congress know what they think. Now, under President Obama's plan, this was one of the questions, my health care plan would be same or better. 50% are scoring it that way. 39% of the American people think that under the president's plan it would be worse. What's your response to that? That's a high negative number, isn't it?
It is a high negative number, which means we have some education to do, because the right answer is it's going to be the same or better. And if you don't have it now, you're going to have an option. If you lose your job and lose your insurance, you're going to have an option. You're going to have a guaranteed health care insurance option available to you at a cost you can afford. So those aspects are obviously very important to all the people who have insurance. And by the way, one of the things that's important to those of us who have insurance, we're paying a lot of our premium dollar for those that aren't included in the system and aren't paying into the system.
Yeah.
This bill is going to provide for everybody to be in a system and to pay up just like automobile insurance. We think that's a step forward for the American people.
Steny, here's another number that I think really jumps out at the American people. President Obama's health care plan is 42% say bad idea, 36% say it's a good idea, but this 22% not sure and no opinion. Aren't these the folks you absolutely have to win over to make this thing work? And how are you going to do that? I mean, it sounds to me like you're going to have to go on a major PR campaign. We just talked with Wendell Potter about, the insurance industry is ruthless. They're win at all cost. They're fighting back on any kind of reform. What about that high number of 22% of the people not sure where you stand?
Ed, under the current system, insurance profits have gone up 426%, salaries of executives. As a result, of course, they're going to defend the status quo. But the American public in that 56% and 94% number know that the status quo is not good for them. They're worried about losing their job, losing their insurance, the costs going up, having the insurance company, when they get sick, not let them sign up for another year of insurance. Their child or their wife has a pre-existing condition and they can't get insurance. That's what they're worried about, and we're going to fix that. And they want us to do it, and we're going to do it.
And Congressman, how much of a loss is it that there's not going to be a vote in the House before the recess?
I don't think that's a loss. I think we're going to get it out of committee. We'll have all three committees, and then people can take a breath, look at what we've done, look at where we are. The Senate's not going to move its bill. It was clear that this bill, the conference report's going to occur in the fall. So I don't think we've lost anything. The fact that we moved ahead was a tremendous step forward by getting it out of committee this week. So I think we're making progress. We're creating consensus. The American public's with us. We're going to get this done.
You got to get this thing done. House Majority Leader Steny Hoyer, great to have you with us tonight, Steny.
Thanks, Ed. Thanks for all you do.
You bet. For more, let's bring in our panel tonight. Laura Flanders is the author of Blue Grit and host